All right, hello everybody. I'm Brian, and this is AAMI News and Conversation. We're here at day 3 of AAMI Exchange in Phoenix, Arizona. Man, it's been a long conference, so you can tell my voice is going a little bit here. But I'm here with Eric today. Eric, why don't you introduce yourself?
All right. Good morning. I am Eric Fraser, so Master Sergeant Eric Fraser. I work for the Defense Health Agency. I'm a senior enlisted leader, and I'm the HTM representation for a group of folks called Knowledge Management. And we take care of all the various policy and training and that kind of aspect for the military healthcare system.
Fantastic. Eric and I, we were talking a little bit last night about, what drives biomeds. I'd love to get to know the people on the floor here at Exchange. It's a time of connection. And you had a great story for me specifically about, realizing the impact of the work you do. So let's start with that. Why don't you tell me your story?
Okay, appreciate it. Yeah, so I'd love to tell this story. It really had a real big impact on my life. So I've been in the military for about 19 years, and I went to BMET Tech School, like so many people here that served in the military as HTM and BMETs. And, when you go to that tech school, it's about 10, 11 months long. Mm-hmm. It's pretty intense. Of course, the military adds another aspect to it. And the tests are very short, and there's a lot of pressure. A lot of folks get washed back. So coming into the career field, it's overwhelming at first.
It's a bit of a gauntlet.
It's a lot, yeah. And so you come in and you pass the course, and you feel great about it. There's a lot of smart people in this career field, so they challenge you mentally a lot. And you get an assignment, you go to your first location, and you start working on equipment. And there's a moment where the first code blue happens, and you think to yourself, oh man, did I work on that defib?
What is a code blue?
So code blue, when there's an emergency, somebody falls down in a clinic or hospital, They might be having a heart attack or something. They call for a code blue, and the crash cart will come out, and that has a defibrillator on it. And so we take care of those as HTM professionals. So first time one of those is used, and you're the one that took care of it, you're like, whoa, maybe this is a thing. I need to, did I work on it? I need to go back and check everything, make sure it's good. So you start to realize that this is important, and there's a lot of pressure going on. And it's great. It's very rewarding. But in 2009, 2008, sometime around there, I got deployed. And so I deployed to Germany. A lot of people say, what? Deployed to Germany. So the way that the military health system works is there's a lot of locations around the world, particularly over in Europe and the Middle East. And there's different roles of care. So you have out in the battlefield, somebody gets hurt. There's BMEDs out there to make sure that there's equipment that can take them back to the various stages, and they come back to Germany, and they come all the way back to the East Coast.
Oh, wow.
And so we have BMEDs all along that way to make sure all that flight equipment is taken care of so folks can be transported back. And so I deployed to one of those roles in Germany, and we got there, and it's a pretty limited amount of equipment that we use. And I got assigned to taking care of ventilators. Mm-hmm. And nobody wanted to do the ventilator. They're like, that's difficult, It takes a long time to take care of. So obviously infusion
But you got through the gauntlet.
I was like, you know what, I'll do it. We'll figure it out. So it took a while. But basically, you would work 12-hour shifts, 6 days a week, working on the same piece of equipment over and over and over again.
Yeah.
And there's a lot of places, a lot of BMEDs that do that all around the world. So it's hard to sometimes grasp, what difference you're making. And a really good mentor of mine was like, hey, let's go out to the flight line where all the planes are coming in from the various locations out in battlefields. Yeah. And let's take some patients off planes. And so we're like, all right, let's go. Let's do this. And we go out there, and they train us on how to do it. And it's nighttime, and it's snowing, and it's Germany.
You probably didn't know what his intentions were taking you out there yet, right?
And we kind of did, but I had no idea, what was going to happen to me when I went out there.
Yeah.
So it was a definitely pleasant surprise in an unpleasant situation. But yeah, we're going out there, and there's a bunch of us sitting on a bus, sitting on a bus, and we're waiting for the planes you see in a lot of movies in the military, where the back opens up and people hang out. Those can be converted as flying hospitals, basically.
Yeah.
And so when they land, a bunch of us go out there, and we take people off planes, and we move them on to that next stage in the echelon of care. And so we're going out there, and there's a person on a plane called the load master, and they're in charge of everything that goes in and off of the plane. And so they're calling people up to take patients off, and they called us up, and they call CCAT, which is basically a critical care person. And when you call CCAT, a lot of people have to come carry them because they have all kinds of gadgets and
It's got to stay stable.
yeah, all kinds of things. It's heavy because you got defibrillators, a defibrillator. Sometimes you have ventilators, a lot of infusion pumps, various things, blood warmers. And so we go up there and we're pulling this gentleman off this plane, and he had come from Libya, and he was in an explosion and had no legs and one arm. Oh man! And it puts you in a place where you're like, wow, this is a lot of people. You don't see that.
Yeah, yeah.
And we're carrying him down the ramp, and the ramp on those things is pretty steep, but they have a lot of traction thing on there. So you're like focusing, like, all right, this is heavy. So you're focusing, don't drop them, keep the legs up and the head down, and that way they're level coming down the ramp. And as we're walking down the ramp, I look down, I'm at the head, so I'm at the left side of the head. Right side of the head is the one in charge of the situation. And I look down, and the ventilator that's breathing for this gentleman has my initials on the sticker.
Jeez. Yeah, there you go. Direct evidence of your impact.
Yeah, so literally, all that tech school, the stress of going through the tech school and the BMETs and our short test times and all the rules and regulations that we have to follow, all the things that organizations like AAMI and the Joint Commission put together, like all of that makes sense in moments like that. So it's really important that BMETs, folks that work on equipment, like we have these stories.
Yeah.
I think every BMET has some kind of story. They're all different, but that really focus, what we do, and we can help pass that along to newer BMETs coming in. Like, yes, you're probably a nerd, right? You work in a shop somewhere.
Like you said, working on the same device day after day, in and out, it could blur.
Yeah, absolutely.
You're going to lose that focus, but moments like this will bring it all back.
We're literally saving people's lives.
Amazing.
And it's a great feeling. So, BMETs should tell their stories. So I really appreciate the opportunity to come tell a little bit of mine.
No, absolutely. And you know what? I'll make a call out here that, BMETs who do want to sell their stories, that's what AAMI's for. We have this amazing community. We appreciate you guys so much. Appreciate you for telling your story today. And I want to hear more. I'm Director of News over at AAMI. You can always reach out to me. My email is on the AAMI website. So we're here for it. Thanks again for sharing, and enjoy the rest of the conference.
Thanks, Brian. Appreciate it.
All right.